Hello, and welcome to the intensive care units at Seattle Children's Hospital. My name is Kathy Ray, and I'm the director of the ICUs. We understand that having a child in our ICU can be very difficult for parents, siblings, and family members. We've created this short video to help you understand the ICU a little better, the people that you will meet, the equipment you may see, and the routines that happen in the ICU every day. We welcome you to participate in the care of your child and hope that you're comfortable while you're here.
The first person you will meet on the unit is the unit coordinator, sometimes called the UC. This is the person you'll check in with each time you arrive. This helps to maintain a secure environment. Besides being key in helping the ICU run smoothly, the unit coordinators can provide you with important information about both the unit and the hospital. Your child will be admitted to a room where they will be cared for by a team of expert pediatric healthcare providers. As soon as your child is settled in the room and your nurse has received report, the unit coordinator will let you know that you may go back to be with your child. There will be several team members involved in caring for your child. The attending doctor is the doctor in charge. They lead the healthcare team in developing a treatment plan for your child and oversee your child's care. When an attending is not present on the unit, one is still on call 24 hours a day. The doctors that you and your child will see the most are the fellows and the residents. Our fellows are doctors who are training in the specialty of pediatric intensive care. The residents are doctors training in the general care of pediatrics. They will write most of the orders on your child and consult with the attending doctor on a regular basis. Both a fellow and a resident are present on the unit 24 hours a day. You will have an ICU-trained registered nurse. Your nurse will coordinate and provide your child's care, continuously monitor and assess your child, and keep the other team members updated. Your nurse will be in the room or nearby at all times, and is your main contact for your questions and concerns. Most of our nurses work 12-hour shifts, so you'll get to know at least 2 of them in a 24-hour period. If your child is with us for an extended period of time, we will make every effort to have a primary nurse care for your child. The respiratory therapists are specially trained to help with your child's respiratory needs. They are the experts in managing the equipment and treatments that support breathing. When it comes to knowing your child, you are the expert, and your support is your child's greatest source of strength. We view you as an integral part of our team and believe that by working together we can best meet the needs of your child. We know that having your child in the hospital is a stressful event. Our social workers are very skilled in supporting your social and emotional needs related to your child's hospital stay. Your nurse may suggest a social work consult, or at any time you may request one. We have a social worker on call 24 hours a day. Each morning, the doctors and other health team members get together as a group for rounds. This is when they discuss each child's progress, current treatment, and any changes that may be made. You are welcome and encouraged to participate in the discussion of your child. This is a good time to get updated and ask any questions you may have. At change of shift, or any time a nurse hands off the care of your child to another nurse, the information related to your child is passed on. This is referred to as report. During this time, orders are reviewed and checks are made to help ensure your child's care and safety. It can be upsetting to see your child connected to various tubes and pieces of equipment. However, it may be helpful to understand what something is and why it's being used. Here are some things commonly seen in the ICU. An IV is a small plastic tube that sits in a vein. This is how we give your child fluids and medicine. Some IVs are in small veins, like the ones you can see on a hand or a foot. Many of our patients have IVs that are in larger veins, such as in the neck or the groin. These larger IVs are often called central lines. Each IV is controlled by a pump. Depending on your child's needs, they may have more than one IV and multiple pumps. Your child may be on a ventilator. This is a machine that helps your child breathe by moving air in and out of the lungs through a tube in the nose or mouth. This gives the muscles that are responsible for breathing a rest and allows more energy for your child to heal. Your child will be connected to a monitor so that we can closely watch things like their heart rate, respiratory rate, and oxygen level. Monitors, like many other pieces of equipment here, may alarm or beep. This is to alert us to any changes. The noise may sound alarming, but it doesn't necessarily mean something is wrong with your child and often can be easily fixed. During this time while your child is healing and needing additional rest, here are some important things to remember. Although we only have space for one parent to sleep at the bedside, parents may be present 24 hours a day. For everyone else, including siblings, visiting hours are 10 a.m. to 8 p.m. So that we can provide safe and efficient patient care, please limit the number of people at your child's bedside to a total of 3. To prevent the spread of infection, please wash your hands or use hand gel every time you enter or leave your child's room. There is a family guide located on the wall in each patient room. This guide contains information about the care and support services here at Children's Hospital. You may find this reference useful during your stay.
We know that having a child in the ICU can be difficult and a challenging time. We want you to know that our staff is comfortable and experienced in supporting patients and families during this time. We are committed to providing your child with the highest quality of care and helping you to stay informed and involved. We have many resources available, and any one of our staff members will be happy to help you with your questions and needs. We welcome you to a place of caring and hope.